find the doctor. Pretty easy. So the nurses are on one side, the medical drama fans are on another side. I think the nurses have a clear edge here.
Can you tell us your specialties and what school you went to?
I'm a dermatologist and I went to UCI.
You know, some specialties in medicine, they do give you a certain vibe. This person does give me the vibe of a dermatologist, but we shall see.
I'm an emergency doctor and I went to UCF as well.
Emergency doctors usually don't look so laid back like this.
I'm a pediatrician and I went to Drexel University.
Okay, she's giving off a lot of these pediatrician vibes. You're like, whoa, I love kids.
I'm an optometrist and I went to Southern California.
This one gives a lot of vibes of an optometry as well.
Can you tell me what 20/20 vision means?
This should be the simplest question on earth for an optometrist to answer.
There's a certain angle that's subtended by the letters that are on the Snellen chart that you're looking at.
Yeah, so this is a very accurate explanation.
You guys were on call. What was your least favorite thing to be woken up by?
It means that you have to kind of do an overnight duty in addition to your day duties.
It's always a grim scene to come into, especially if children are involved.
If you're practicing urologist, your calls wouldn't really be about accidents unless it's very specifically down there. This guy is a bit high on my radar as well. We shall go on.
I got a little bit annoyed with the Tylenol call.
I haven't been on call as much, honestly, but
Yeah, basically if you're an optometrist, you're not even on call.
We're ready to make an elimination.
I think the most obvious one would either be to go with the urology. Guy is kind of saying something that's a bit general.
Intra versus inter, since you're a dermatologist, what's the difference?
So it has been a while since I've been in medical terminology, but I definitely use inter a lot, and that would be inside. And then intra, gosh, I don't remember off the top of my head.
How can a doctor not know what's the difference between inter and intra? That's a bit sub.
Can you name me the different kinds of cruciate ligaments?
If he's a physical therapist, he should know better.
We have the anterior, interior, you have a meniscus, those are the main.
I have not heard of meniscal cruciate ligaments in my life.
Are we allowed to eliminate two?
No, just one.
Okay.
They found 2 fakes already? I think number 3 is still very legit. Number 4 is definitely a bit suspicious.
He answered with
Meniscus.
which is not a cruciate ligament.
Wow, they know as well.
If a patient had glaucoma, what kind of prescription would you give them?
Alright, this one I can answer.
you could give them something called latanoprost. So it's an eye drop. You do that one at nighttime.
Then Tanopros, yeah.
1 and 4. Could you tell me what kind of cars you guys drive?
This is such a random question.
I drive a Toyota Honda Highlander.
I drive a Honda CR-V.
I don't know what you get out of asking what doctors drive.
I think we're ready to make another elimination.
Yeah, I would eliminate number 4 and number 2.
Both teams have decided that one person is definitely not the real deal. Number 4.
I think the real contender here would be between the pediatrician and the guy who is in emergency medicine. But the thing is that the emergency medicine guy receives all the very simple questions so far.
I would love to hear your wackiest story from a patient on the job.
It was a vaginal occlusion. She and her friend had been playing around with a bottle and created a vacuum.
A mother asked me, is it okay to put false eyelashes on her newborn baby for pictures?
All right, we're good to eliminate.
Yeah, number 2.
For doctors 3 and 5, you walk into the room and you see the patient's monitor. You feel their pulse, there's nothing there. How many joules are you going?
No pulse, no breaths, flat line. Basically gonna jump on the guy and we're gonna start CPR. Chest compressions, as Dr. Mike would say.
5.
5 joules wouldn't even shock an ant, man.
200.
Straight up, that guy knows what he's saying.
The answer is none because you don't shock asystole.
The problem here is that the situation is unclear. But they are right. I think it's really hard to eliminate people.
What is the average heartbeat of a newborn versus a 1-year-old?
Really, the newborn's heart beats much faster.
For a newborn, it's lower, so maybe like 35 beats per minute.
You look at the nurse's face, guys. She's like, nah, you don't know the... Yo, you're talking crack right here. Definitely out. They will answer for sure.
Doctor number 5.
He answered that a resting heart rate of a fetus or infant is 35.
Guy dead, probably.
We're
Live.
gonna have a demonstration. Doctor number 6, do a little eye exam with my pen light on Andre.
That's a very specific request.
So first I'm going to be checking to see if your pupils are equally responsive to light. So just look straight ahead for me, please.
Yep, look straight ahead. And the swinging pentosh test, she did that too.
Can you tell me what medication you typically prescribe to patients with cystic acne?
The acne is bad enough, we're gonna put them on Accutane.
Oh, that's correct.
Does a bar of soap clean the face pretty well?
It can.
The guy is like, I'm learning something today, man. Whoa! Final guess, 3 guess 1. I think you can read up on things like isotretinoin. For the physical exam on the eyes, you technically could do it as well. I'm actually a bit more inclined to choose number 3, you know, but we shall see, we shall see.
The cones that are in our eye, what do?
So they help you perceive color.
What colors do we see?
Trying to think.
This is like a classic example of digging your own grave. Rods and cones, they help you to see better in light and in dark.
Red, green, and yellow.
Somebody has a mole. They want to get it checked out. What are some things they should look out for?
So changes in shape, color, if there's any pain, that's definitely something we want to know.
That is all I needed.
I actually am a bit confused at this point of time. Let's listen to the team's guesses first.
We
okay?
think the real deal is Dr. Number 1.
Dermatologist.
We think the real deal is Dr. Number 1.
She does give off a very professional dermatology kind of vibe.
Oh, what the heck?
Well, I guess that's 20 push-ups for me. It is what it is. I actually think that the optometrist might be an actual real doctor. She has been giving relatively reasonable answers. That would be my second choice. Let's go! I was actually right the second time. Well, that's all we have for today, and we're gonna do 20 push-ups to wrap up the video. Top tier push-ups now. 1, 2, 3, 4, 5. 20. So I hope you enjoyed the video, and I'll see you in the next one. Bye bye!